next, I want to call upon Ms. Heena Bharti. She has done her bachelor's in prosthetic and orthotics from the All India Institute of Physical Medicine and Rehabilitation from Mumbai. She is a part of the team of Food Secure at RxDx SAMANVAY. I welcome you, Heena. She will be talking to
Thank
us
you, ma'am.
about the importance of orthotics in these ankle injuries and diabetic foot injuries.
Yeah, so thank you, ma'am, for your lovely introduction. So today my topic is role of pediatrics in diabetic foot and sports injuries. So, like most of the things Dr. Sanjay and Dr. Prasan they have already covered. So, like we are running out of time also. So I'll just quick start on my presentation. Actually, in India, many people they don't know actually what is exactly pediatrics and orthotics. So I'm going to talk about that. So pediatrics is the management and treatment of condition of the foot and ankle and lower extremities requiring fitting, fabricated and adjusting of pediatric devices. So we are specialized to do lower limb and biomechanical assessment and gait analysis, and we are specialized in treatment plans and manufacturing. It can include footwear, custom-made foot orthosis, and further modifications. So what we are doing here for people is we are helping them get back to whatever they wanting to do, whether it's running marathon or getting back to what they want to do with lots of less pain and discomfort. So when we put a person in right shoes and put orthotics in that shoe, so we have this power to change their day-to-day life, which is not be very stylish or glamorous, but it will be a nice experience and very comfortable for them. So now we are moving forward for next slide. So what is their approach? So pedorthics, so they works towards long-term maintenance of healthy foot and prevention of foot damage. So for any person who are diabetic or non-diabetic or who are sports people, for them right fit shoes is always important. So what we do in here in our clinic, so we do evaluation of the footwear and even patient feet with different technology like plaster pressure scan, which Dr. Sanjay already showed in his slides. Like after a few kilopascals, how much normal people need between 200 to 300 kilopascal, like normal in diabetic patient it will affect. So if it is more than that, chances to get callus or some other deformity, especially in diabetic cases. So, and in diabetic cases, mainly is like so many neuropathy problem is also there. So now we will talk about role of sports injuries. So in sports injuries, like as we know, so in foot injuries are most common injuries for the athletes. So many sports subject the foot to excessive weight loads. So it's like for example, during a normal run of 100 miles, the foot strikes to the ground approx 15,000 times with a force equal to 3 or 4 times to the runner's of body weight. So greater speed means greater pressure on the lower extremity. So in that case, if we give good shoes with the proper support, so it will help avoid that injuries for the future. And having proper footwear, athletes avoid the mitigate injuries to their feet. So modifying the shoe, adjusting the lace, or wearing appropriate orthosis will help an athletes avoid or recover from injury. Whether the needs is preventive, accommodative, or conservative or compensatory, foot support can help athletes remain active and enjoy their sports to the fullest. So now we are talking about what is the role of pediatrics in diabetic conditions. So diabetic, as we know, they are frequently getting this neuropathy or nerve damage in the feet. So nerve damage can lead to loss of sensation, leaving a patient unable to feel pain, heat or cold. The longer patient had diabetes, the greater the likelihood of developing the problem. So since the extreme consequence is amputation, foot care for someone with diabetes become a daily priority. So that is where pediatrics comes in. So shoes orthosis protects the feet and improve their function. Since the feet is work in conjunction with legs, knee, hips, and back footwear, also affects a person's ability to perform physically. Foot problems can lead to stress and strains on other part of the body. So what we look for and physical facts. So for health reason, people should generally look for shoes with a stable, resilient sole and leather or fabric upper section because both materials breathable and it allow air to reach the feet and air circulation help prevent growth for fungus or bacteria. There should be a roughly thumb width of space between the longest toe and the end of the shoe when the wearer is standing. The extra space accommodates feet as they expand during motion. So the heel area should not be pinch the foot. So shoes with lacing or other fastening allow adjustability, which can be important for people with diabetes because some people they not prefer with the proper lacing shoe or the proper velcro one, the adjustable one. So in that cases, this will more helpful if they can go for something with adjustable one. So shoe size is not very absolute a size by so in India, actually, there is a not proper size everyone not get. So suppose if like someone having 8.5, so that is the challenge in India to get the proper size. So in that case, we need to see the proper size of the shoe and the proper fitting. So the foot also can be fabricated from a variety of materials. So they know what will yeah, so there are different types of material in like according to the patient's conditions. Like in diabetic, we need some other as Dr. Sanjay told, MCP and MCR there is very less light. So now we are adding poron or some other different materials, so it can increase the life of the insoles or the footwear. So now there is a different technologies like advanced material for that.
Busy schedule, I think you're super busy at home and you have actually given us a good idea about how we should plan about, going about the footwear design. And I think out of personal experience, I had actually gone to Hina and got that you call it orthotics pathway done, no? Because I was suspecting that I have a flat foot and all of that. So I think she does a really detailed examination and explains really well.